Thank you so much for that introduction. So this summer, I had the privilege of working at Benioff Children's Hospital in Oakland with my mentor, Dr. Robert Hagar, and he works primarily with pediatric and adult sickle cell patients. So first, some background on sickle cell disease. Sickle cell disease is one of the most common recessive heritable blood disorders worldwide, and it affects approximately 300,000 newborns every year. Sickle cell disease basically works by causing these vaso-occlusion-induced hypoxias on account of their abnormally shaped adult hemoglobin. And this causes patients to experience these debilitating pain crises and has a significant impact on their quality of life. Recent advancements in medical care have greatly extended the lifespan of sickle cell disease patients. However, chronic kidney disease appears to be the leading cause of death and morbidity for sickle cell patients. For this reason, we decided to focus our investigation on the progression of chronic kidney disease in sickle cell patients. Specifically, our investigation is focusing on one molecule in particular, uric acid, and evaluating how high uric acid or hyperuricemia influences the rate of kidney function decline in sickle cell disease patients. Uric acid is a byproduct of the xanthidine oxidase pathway and linked to the natural breakdown of red blood cells. Our decision to focus on hyperuricemia comes from multiple promising studies exploring hyperuricemia in pediatric populations, but never in adult sickle cell patients. So this work is actually a follow-up study from my work with Dr. Hagar last summer. Last summer, we demonstrated a statistically significant connection between hyperuricemia and chronic kidney disease. However, as shown in these two graphs here, we couldn't say for sure which one came first, the hyperuricemia or the chronic kidney disease. Hence, we were unsure if hyperuricemia causes chronic kidney disease or if hyperuricemia is just a symptom of failing kidneys. So our key objective for this experiment was to examine if this increase in uric acid precedes the decline in renal function and establish a more causal relationship between the two variables. The database we're working with contains the clinical results for about 500 patients with sickle cell disease over the past 5 years. The variable we chose to measure renal function with is called glomerular filtration rate, or GFR. This is a measure of the volume and rate at which the kidney can filter incoming blood. The lower the GFR, the worse the renal function for those patients. And the most important difference this time around was that we wanted to examine how uric acid affects the rate of eGFR decline, rather than just the mean eGFR values, which is what we did last summer. So the following two graphs depict the longitudinal eGFR values for sickle cell patients at Benioff Children's Hospital from July 2022 to July 2023, with graph A representing those that started with above a certain threshold for healthy renal function, and graph B representing those that started below a threshold for healthy renal function. And while this visual is a bit overwhelming and difficult to pinpoint any particular trends, when further statistical analysis was conducted and we cross-referenced these rates with the uric acid values, we made some interesting observations. So the first of which was shown in figure 5 with the t-test. This t-test conducted on patients' initial uric acid values and compared it to their rate of eGFR decline. And our finding indicates that there was a statistically significant relationship between initial uric acid levels and the rate of eGFR decline over time, which is shown in red with a p-value of about 0.01. And then we went one step further and conducted a linear regression analysis while controlling for some suspected modulators of eGFR, including hemoglobin and creatinine levels. We found that uric acid is still a strong factor with an increase in rate of eGFR decline of about 19.4 units of eGFR for every 1 unit rise in uric acid. And we just missed our statistical significance threshold with a p-value of 0.067. So to conclude, this investigation found a strong trend in the relationship between uric acid levels and the rate of eGFR decline, even when controlling for some key modulators such as hemoglobin and creatinine. In this study, we only tracked patients because of time constraints over a 1-year time span, which we believe is far too narrow of a window to investigate long-term trends. Moving forward, we aim to continue to collect data prospectively and further investigate the relationship between uric acid rates and eGFR decline over time over a more robust time frame. These findings have the potential to inform both future research in the natural history of renal dysfunction in sickle cell disease and possible preventative and corrective treatments. One such treatment are angiotensin receptor blockers. One example is displayed here on the screen of an angiotensin receptor blocker known as losartan, which is extensively researched primarily for its role in blood pressure medication. So this drug is widely available and safe to use, which means it can have a real impact on patients' lives soon if we conclude that these results are statistically significant. Thank you very much.